Good morning. I want to thank everyone for joining us here today. I would venture to say that everyone in San Diego knows someone in their life who suffered from the illness of addiction. A family member, a friend, a coworker, a loved one. And when you've been in that situation, you know how overpowering and overwhelming the nature of addiction can be. You also know how devastating the consequences, not just disruption of life, potential loss of life. When you meet a parent who's lost a child as a parent, you just want the best for your kids and you grieve about your kids, you worry about your kids, you have anxiety about your kids. And when you meet a parent who has lost someone to addiction, it is heartbreaking. We also know in San Diego County, we have had year over year increases in overdose going back more than a decade long year over year increases. But we know how particularly acute and how much more severe it's gotten in the last 2 years. In 2021, 800 people died of fentanyl in San Diego County, a 400% increase from 2 years before that. Last year, more than 900 San Diegans died due to opioid-related accidental overdose, a 54% increase from the year before. The tragedy and the epidemic of overdose in our county is something that's impacting the entire nation, but it's something that motivates us to act, recognizing that every single one of these individuals is a life that has been lost. It is a loved one, it is a friend, it is a family member, and so it motivates us to act. We also know that the nature of the opioid addiction originated in its severity from greed. The Sackler family and Purdue Pharma, in an attempt to make billions of dollars of profits, created an epidemic of opioid overdose in this country. I believe they should be in prison. But as a county, our only recourse we have is to civilly sue them. And the county of San Diego has not only sued the Sackler family and Purdue, but a whole bunch of other entities that were involved in profiting off of our families and profiting off of the future of our children. We expect as a county to receive upwards of $100 million in settlement funds. The exact amount will be determined as each of these lawsuits is resolved, but we think that is a conservative estimate of the money that will come to the County of San Diego to try and mitigate and deal with the problems we face today surrounding opioid. Now, as a county, we have two choices. We can wait for all of those funds to arrive, and then when they arrive, we can get the funds and we can start talking about and thinking about what we could do, and we could take months upon months and then docket something for the board and then begin to act. But the immediacy of the crisis brought Supervisor Anderson and I together to say, you know what? Let's do all of that work before we receive the money. And Supervisor Anderson have spent the better part of the last 6 months convening groups, family members, health care folks, substance abuse treatment folks, law enforcement, district attorney. We've convened them all to say what is the framework around investing the opioid funds that we can put in place so that the minute we receive these funds, they can hit the streets and immediately be put to work. Because the urgency of the situation we face on the streets today does not allow us to wait till 6 months after we receive funds to figure out how they need to be spent. And so next Tuesday, the Board of Supervisors will be considering an item with Supervisor Anderson and myself on the opioid settlement framework. This framework will provide the parameters and the programs that we will invest in. And so we are ready to go the minute the county receives funds to put those funds to work on the streets to try and save people's lives. The framework provides with us an outlet for the best way to invest, expanding access to medically assisted treatment, putting wellness advocates in hospitals when people overdose, a moment where you can reach them and connect them to services, providing wraparound services and housing for individuals who are suffering from addiction, providing drug disposal strategies. There are some innovative, really creative ways we can remove a lot of the opioids that are in our homes and communities before they trigger addiction, providing life-saving harm reduction programs, and doing dedicated public information and education campaigns, particularly targeted and focused on our youth. With this plan in hand, once those settlement dollars start coming in, we can immediately put them on the street. The framework is structured to provide guidance on a multi-phased implementation plan. Certain programs will be implemented immediately as the funds become available, and others will require building upon that progress in the years to come. We built in flexibility to give us the ability to adapt to best practices, But essentially, we broke the funding down in 3 separate buckets, and within each bucket, there are several programs. The first is health integration, integrating our substance abuse and opioid-related treatment system into our existing healthcare system in a better way. The second is harm reduction and prevention, helping facilitate folks getting into treatment and efforts around trying to prevent people from beginning to use drugs in the first place. And the third is social supports and services. These are a lot of the wraparound efforts for individuals who are suffering. We made available for each of you a copy of the report along with what we are bringing before the Board of Supervisors, and you can dig into them in more detail, but I wanted to highlight a couple programs that I think can be particularly impactful. The first is working with the emergency department, a model called Relay and other services, and this would be a 24/7 on-call program that would dispatch a wellness advocate to a hospital. Anytime there's a reported overdose, we have somebody trained, someone who had lived experience, someone who's overcome addiction, that anytime someone gets taken to a hospital who's suffering from an overdose, we deploy that person to meet them where they are. At the moment someone has survived an overdose, you may have the best opportunity you'll ever get to engage them and talk to them about treatment options and how they can try and get their life back on track. Wellness advocates stay in contact with this individual for up to 90 days after their incident to really connect them and help them integrate into services and get help. The second program is drug disposals, funding for community drug disposal programs and the availability of drug disposal bags to all households in the county, along with a public awareness campaign. So many folks begin the journey to opioids by using available prescription drugs, often drugs that were not prescribed to them. Folks' medicine cabinet are full across this county, and we don't make it easy to dispose of those drugs. And there is technology that exists. We could mail every household in San Diego a drug disposal bag. You open the bag, you pour whatever pharmaceutical prescription drugs you have in it, you add some water, and you throw it in the trash. A moment where we could clean the shelves throughout San Diego County will be a huge effort in lowering the availability of drugs. People break into homes to steal the prescription medicine. Kids get into their parents. People sell them, and we want to do what we can there. Expanding medicated assisted treatment into our hospital emergency departments is integrating drug treatment into existing healthcare, and we can provide funding for that. And then comprehensive wraparound services. The reality is an individual who's suffering from addiction, if they're on our streets, are not going to get better if they're not housed. And so using some of these funds for those individuals suffering from opioid addiction to actually get housing, to get transportation, to get the help and support they need to get their life back on track can help those individuals recover from addiction and can help us meet individuals who are on the streets and unsheltered and potentially help them get housed permanently. And then working with rural communities and tribal partners, funding efforts, education, treatment in rural communities, engaging our tribal communities. Some of the greatest areas of opioid overdose are not in your urban centers. Some of the highest numbers in San Diego County are in East County. They're in Supervisor Anderson's area. They're in North County. And so working in partnership to make sure that we are providing the access and availability in our rural communities is vitally important. This crisis is not a partisan issue. It does not, opioids don't know to only target a Democratic household or a Republican household. It impacts all of us. And this is an issue that compels us to work together. And I appreciate Supervisor Anderson's partnership on this. You know, Supervisor Anderson and I, we may not agree on every issue, but we agree we need to come together to support our families, to protect our kids, to make sure that we're tackling the opioid addiction. And so I really appreciate his partnership. I appreciate his engagement. I appreciate everything he's brought, and we're bringing forward a bipartisan approach to put the framework in place to allocate and spend and invest upwards of $100 million in an effort to save lives and reverse the trajectory that San Diego County is on. And so I greatly appreciate Supervisor Anderson and his leadership and would like to welcome him to the podium at this point.
Thank you. When Chairman Fletcher asked me last year if I'd be interested in working on this issue, he knew that my district's most impacted by this. You've heard that rural communities, tribal communities, are at the tip of the iceberg on all of these issues. And I want to thank him because I said there's 3 things I wanted to know. I wanted to know that we'd be proactive. For far too often, government waits till the money comes in and then scrambles to figure out how to get the money out and use it effectively. And when you rush to do things, rarely do you do it effectively. And he said, absolutely, we're going to create a framework in advance so that we can plug in that money immediately and get a return on that investment in our community. The second issue I had is I said, this is impacting a lot of folks. I mean, there's a lot of family members, and not many people know about it. I asked him, I said, are we going to have an aspect where we let individuals know and families know the harm of opioid this crisis? And he said, absolutely. And we're going to, and I said, finally, are we going to look at all the best practices across the United States? And you heard Chairman Fletcher speak about the New York-based program that's been highly successful, where they're using peer mentoring at the very moment a person is coming back to life on a gurney, and they're most vulnerable to the truth in changing their life and working towards changing it. If you allow, what's happening currently is people will go through this, their life will be saved, and then they'll walk out in the streets, and within 3 weeks they repeat what they went through already, because we've done nothing to change the pattern of abuse. And so I'm very proud to be up here today with Chairman Fletcher, because on all three of those items, he said we are aggressively going to go after it in a proactive way. And one of the things that, through this framework and talking to law enforcement, talking to medical professionals, that was a real shocker to me, was that part of the opioid problem in our jail system is that they've figured out ways to smuggle it in by simply putting it on a piece of paper and mailing it in, where it can be reconstituted at a later date, so there's no way to detect it. This is a terrible, terrible epidemic, and I'm really happy that we're moving in the direction we are to lift people in our community and to save family members and friends and neighbors. This is really important work, and in all my years in the legislature, this is one of the things I'm most proud of here at the county. So thank you, Chairman Fletcher, for your innovation. Thank you for your insight, and thank you for inviting me to be on your team.
Thank you, Supervisor Anderson.